So what the MitraClip does, it's like a high-tech clothespin.
Dr. Mark Katz is a cardiac surgeon and chief medical officer at the Institute, which successfully performed Central Virginia's first MitraClip heart valve surgery on 96-year-old Garney Bowen, who had to sleep at night with an oxygen tank.
I imagine it's a whole lot of people in the world that needs to work on their heart.
But at his age, conventional surgery would have been too risky.
Up until recently, there hasn't been a good option other than medicines, which really don't do a lot to help with these problems. So the MitraClip is part of an overall category of transcatheter valve therapies. It's approved only for these high-risk or non-surgical candidates, but that's a huge population of patients who've been underserved up until now.
And I figured if I could do that, it would certainly make my life better.
Dr. Katz worked with UVA's Dr. Scott Lim, who performed Virginia's first such surgery that is minimally invasive and involves inserting the clip into the femoral vein, steering it to the heart by procedural imaging, and implanting it into the mitral valve. Dr.
Lim is here to help us build our program. He and I are going to be working closely together on these procedures. We'll both be involved in the procedures in the clinic. We'll both be seeing the patients in the clinic.
The procedure is FDA approved, it's covered by Medicare, and the clips can last a lifetime.
We actually did a study recently where we looked at all the echocardiograms just at the 7 Bon Secours hospitals in Virginia. And looking at that, the patients who had a severe leakage of their mitral valves, we found 900 patients in the last year.
Bon Secours had done 3 more successful surgeries and had at least 50 referrals after only a month, and plans at least 2 a week going forward.
Let them fix it. I've been real fortunate to make it this far, and I'm looking for the double zeros now.
Garney never made his double zeros. He died of natural causes shortly after this video was made, but his doctors and his family say the MitraClip made his last days more comfortable, and they encourage others to consider the option. For Science Matters, I'm Charles Fishburne, WCVE News.